Before your surgery, you will either have an over-the-phone consultation or an in-person appointment in our preoperative clinic. If you have an in-person appointment, the staff will conduct some diagnostic tests in order to prepare you for your surgery. These tests may include blood tests, chest X-ray, electrocardiogram, and a physical exam. Be sure to tell the staff if you have any allergies. You or anyone in your family have had problems with anesthesia in the past. Any allergies you have, particularly to seafood or iodine. You have a pacemaker. Bring the card in from your pacemaker manufacturer with the model number. If you have a history of falls, problems with mobility, and/or difficulties in hearing or learning. It's very important for you to tell the staff about any medicine you are currently taking, including prescription medicines, over-the-counter medicine, or dietary supplements like vitamins and herbs. You will be given instructions on what medicines you can take in the days leading up to your surgery, including the day of your surgery. It's important to follow these instructions. This will help prevent possible complications during your surgery. It's best if you can stop smoking at least 4 weeks before your surgery. If you smoke, you're more likely to have medical problems after your surgery. Information to help you stop smoking is available in our Patient and Family Resource Center outside of the cafeteria on the first floor of the hospital. You may also call the New York State Quit line at 1-866-697-9497. They have trained specialists and many resources to assist you. Do not eat or drink anything after midnight the night before your surgery. This will help prevent possible complications while you are under anesthesia. Take your regular medicines only as instructed in your preoperative visit. The night and morning before your surgery, you should wash your body thoroughly with antibacterial soap and water. Because you may not feel like washing your hair for several days after your operation, you may want to wash it the night or morning before your surgery. Do not apply lotions, powders, deodorants, or sprays after washing. When you're in the pre-op clinic, you'll be provided a phone number to call the day before your surgery. When you call that number, you'll be given the time that you should arrive on the day of your surgery. You may brush your teeth and rinse your mouth with mouthwash, but avoid swallowing any water or mouthwash. If your physician or anesthesiologist has instructed you to take any medications, take these medicines with a small sip of water only. Here's what you should bring with you to the hospital: list of meds, hearing aids, and canes or walking aids if you use one. If you have any valuables, have a family member keep them safe during your procedure. Do not bring any jewelry. When you arrive at the hospital, go to the Patient Access Department, Registration, located in the hospital lobby on the ground floor. You'll be directed on where to go by the Patient Access staff. Your family may wait in one of our surgical waiting areas, and your physician will talk with them after the surgery. Depending on your surgical procedure, you may go down to the Nuclear Medicine Department for the initial portion of your sentinel lymph node biopsy. Your family can wait in the waiting area in nuclear medicine. Your surgeon, with your permission, will speak with your family members regarding the surgery. If you're going to be admitted after your surgery, you'll be transferred from the recovery room to your inpatient bed, generally on the 6th or 7th floor. If you're going home after your surgery, you'll recover in the ambulatory surgery area where you first were checked in and seen by your surgeon. You'll receive post-op instructions, including how to care for your surgical incision. You'll receive a prescription for medications to be taken in the post-op period, including pain medications. Even if you feel you may not need it, it's a good idea to get this prescription filled so it's on hand in case you do. In general, you should avoid driving, operating machinery, and consuming alcohol when taking pain medications. Speak with your pharmacist regarding concerns, especially if you take any other routine medications. Pain medication can often cause constipation. Make sure you drink plenty of fluids. Eat foods containing fiber if permitted by your physician. These include fruits and vegetables. And get regular exercise. You may need to take a gentle stool softener along with your pain medication if you experience constipation. Leg exercises are important in helping to prevent the formation of blood clots in your legs following surgery. These exercises will help you recover from surgery more quickly, and you should practice these before and after your surgery. With your legs straight, first point your toes down, then bring your toes up towards your head. Do this exercise 10 times every hour with one foot and then the other foot. With your legs straight, rotate your ankles one at a time as if you were drawing little circles with your toes. Do this exercise 10 times with one foot and then the other foot. These exercises are helpful in the few days following your surgery, especially when you may not feel like walking around or exercising much. When you're able and comfortable to engage in more exercise, you can discontinue these leg exercises. Coughing and deep breathing exercises will help you clear your lungs and help prevent pneumonia. They will also help you recover from surgery more quickly. Please follow these steps. Take a deep breath through your nose to filter, warm, and moisten the air. Hold your breath for a short time. Exhale slowly and gently through pursed lips as if you were blowing out a candle. Do this for 3 breaths. On the 3rd breath, cough instead of breathing out. Repeat this deep breathing 2 more times. If you've been given an incentive spirometer, please follow these instructions. Place the mouthpiece in your mouth. Draw in air as if you were sipping liquid through a straw. Try taking slow, deep breaths to hold the piston up as long as possible. Do this 10 times every 2 hours. Your doctor will determine when you are able to go home. Factors that can determine when you are discharged include good control of your pain, your ability to get out of bed and walk, and your ability to eat, drink, and void. You'll receive written discharge instructions from your nurse before you go home. Please feel free to ask your doctor, resident, fellow, or nurse for help or information. We'll give you a prescription for pain medicine when you leave. The day and time of your first follow-up visit may be set at this time. The first follow-up visit usually occurs about 3 weeks after discharge. Each day following your surgery, you will feel better. Here's a guide and some general instructions for you to follow to aid in your recovery. Wear clean, loose clothing over your incision. Eat a balanced diet and drink plenty of fluids. Leave the gauze dressing on for 48 hours. After 48 hours, you can remove the dressing and take a shower. Clean your incision once a day and as needed with soap and water unless your doctor has different instructions. Pat it dry with a clean towel. Do not take a bath, swim, or sit in a hot tub. Do not put lotions or powders on the incision area until the incision heals completely and has no open areas. Make sure you call your doctor if any of these occur. A fever greater than 100.5 degrees Fahrenheit. Increasing pain that is not relieved by pain medications. Redness or drainage from the incision site. If your drain is not working or bleeding. Know that you can call anytime, including after hours or on the weekend. Just call 716-845-2300 and you'll be able to speak with an on-call physician. He or she will provide you with guidance, including calling in a prescription to your pharmacy or instructing you to either come to Roswell Park or to go to the emergency room to be assessed. If you have a life-threatening emergency such as chest pain or shortness of breath, call 911 to go to the nearest emergency room. We hope this video has helped you better understand what to expect at your upcoming surgery. If you have any questions or concerns, please call us at the Melanoma Center, 716-845-3100. 80.